Well, first, thank you. Good morning, everyone. Thank you for attending today's webinar. Hopefully, we can give you a lot of vital information, important information, and answer a lot of questions that everyone may have as you transition into having Medicare. Okay. All right. So again, my name is Ish Pina. I'm the Assistant Benefits Manager here at Acera, and I oversee the health, dental, and vision plans and anything that's medical, dental, vision with Acera, Medicare, Medicare Part B reimbursement, things like that. I oversee that to make sure that everything is going well for members, and I also help to educate the team so they can assist anyone who contacts Acera regarding any of those items. Okay. So today we'll be giving you a Medicare overview with the various parts. We'll talk about Acera and Acera Medicare mandate, Medicare, how it works, Medicare plan options, and of course, I'll be here for questions if you have any. Okay. Right. All right. So who is eligible for Medicare and who's involved? Okay. Well, typically people over 65 are eligible for Medicare. There are some who are under 65 if they have a disability and is deemed a certain percentage, or Social Security has their own criteria for disability. So you would have to speak with them and they would talk to you and ask you certain questions. And if they deem that you have, you're disabled beyond a certain percent, according to what they have, then they will be able to grant you your Medicare early, okay, and under 65. So we do have several members like that also. People of any age with ESRD or Lou Gehrig's disease. Okay. Social Security Administration, they're the ones that that pretty much sees it. So if you're, and I'll talk about this a little bit later on, but they will send you your Medicare card early if you are already collecting a Social Security benefit. But we'll get into that in just a moment. And of course, the Center for Medicare Medicaid Services, or also known as CMS. Okay. So, and here we go. So if you are currently receiving your Social Security benefits, then enrollment in Medicare Parts A and B is automatic. Okay, so they will mail you your Medicare card. Typically, it's a month, 2 months, a few months in advance. I've had someone contact me like four or 5 months in advance. They've gotten their Medicare card already. So wow, they're on a roll getting things out to everybody. So the Medicare Part B premium will be deducted from either your Social Security check or you will be direct billed, because some members you don't want to start collecting your Social Security because you want to wait till you're an older age, so that of course you can receive a larger benefit. So so you're not getting your Social Security, however you've turned 65, so you want to make sure you contact Social Security to advise them that, hey, I'm 65, want to make sure that you have everything you need for me to get my Medicare Parts A and B, and then they can go ahead and check their records. And if there's anything that they need to update, they'll be able to do that at that time. Otherwise, they'll go ahead and get you started with the process. Okay. So your Medicare card will be automatically mailed to you if you are collecting Social Security benefits already. Okay. And there is a window, a certain number of months, and I'll talk about that in just a moment. So some retirees or dependents who are disabled may be eligible for Medicare earlier than 65, as I mentioned earlier. Next slide. So not receiving Social Security. So if you're not currently receiving a Social Security benefit, most retirees are eligible to enroll in Medicare Parts A and B at 65. So basically at 65, when you turn 65, anybody can go ahead and apply for Medicare. Okay. So we do encourage you to start this process for enrolling into Medicare, at least 90 days prior to your 65th birthday. Okay. Call Social Security Administration by contacting them on their 800 number to obtain information on how to enroll, or you can go to the Medicare website to enroll online. Okay. If you do decide, because I believe now that they say COVID's pretty much eased up and they're allowing offices to be open. So if they do allow you to come into the office to make an appointment, is the best way to do it, because otherwise, if you just walk into a Social Security office, try to talk to someone face to face, you may be sitting there for quite a while. It's kind of like DMV. So you want to make sure that you make an appointment, if you can, to see someone face to face. That way, you're only waiting just a few minutes. Okay. Okay. So a SARA's mandate. So when you or your dependent become eligible for Medicare, which is usually at 65, in order to continue enrollment and receipt of the Medicare plan, you must complete the enrollment process into a SARA Medicare plan. Okay, so if you're on Kaiser, okay, and one of you turns 65 and become Medicare eligible, then you need to go ahead. That person who's getting Medicare needs to enroll into the Kaiser Senior Advantage plan. Okay, if you guys are on the United Healthcare plan, we don't have a Medicare plan for United Healthcare, so you would transition over, either going over to the Kaiser Senior Advantage plan, which is a NASARA group plan, or you can transition over to Via Benefits, and they can assist you to find a Medicare plan. So if you like your United Healthcare doctors, that's fine. When you talk with Via Benefits, you let them know that, and they can see what they can find for you as far as United Healthcare Medicare plan that would allow you to still see your doctors. Okay. Go back. Okay. So this mandate applies to retirees who are receiving the monthly medical allowance, because as you know, by being on a SARA plan, as long as you have the years of service, SARA does subsidize towards the monthly medical premium, and so it helps to pay for that. So you want to make sure that you enroll into your Medicare so you can continue receiving that benefit as far as our credit that we apply towards your premium. Okay, so again, once more, the only Medicare plan that we have internally at SARA is the Kaiser Senior Advantage Permanente plan. Okay. Otherwise, you would contact Via Benefits for a Medicare plan, and those plans are individual. They are nationwide, so you enroll into a plan with them. Okay. Screen. Okay, and so here's how the Medicare, with the mandate, here's one of the reasons why you to try to show you that you can save money by getting into your Medicare and getting onto a plan. So for example, here we have Kaiser HMO. The premium for that HMO one party is $909.74. We're going to use this sample of this member who has 17 years of service. So the monthly medical allowance, the MMA that SARA provides for this member who has 17 years of service, is $462.09. So right now, out of pocket, coming out of their monthly retirement benefit, is $447.65. Because the premium for the one party is $909, we're giving them a credit of $462, which leaves the net difference of $447 to come out of their monthly benefit. The same person enrolls in Medicare, okay, gets onto the Senior Advantage plan with the SARA, which is $316.81. We're going to subsidize $316.81, leaving your out-of-pocket cost for that plan as $0. That means $447 that used to come out gets to stay in your net. You get to keep that. So you can see how it's pretty good substantial savings, where you get to save you some money by going into the Medicare plan and being on the coverage like that. Okay. All right. Okay. So what is Medicare Part A? Well, Part A provides hospital insurance. It helps to pay for Medicare-approved hospital stays in skilled nursing facilities, rehab, not long-term care. It does take care of hospice care, home health care, although there are some limitations. Blood and hospital care for qualified medical providers. You typically do not pay a premium for the Part A. If you've worked enough quarters, then typically Part A is free. Okay. As long as you've paid into the system long enough. But we will come to, I'll talk about the Part B only plan in just a moment. Okay, next slide. All right. So again, Majority of us who have done enough quarters, paid enough quarters, gets Part A for free. Okay. Um, if you or your ex-spouse were married for 10 years and paid Medicare taxes um, while working or earned quarters towards Medicare, there's still ways you can qualify for the free. So, okay, as you can see, 40 plus quarters, it's free. Part A premium, there is no Part A premium. Less than that, you may end up paying $274 a month. If you didn't pay it at all, chances are Medicare is going to try to give you the A, but they want to charge you that $506 a month just to have the Part A. Okay, so again, if you do go to apply and they tell you that you are expected to pay a premium for Part A because you didn't put in enough quarters, definitely contact us, Sarah, and we can kind of walk you through that. However, in most cases, if you choose to buy Part A, you must also have Part B and pay the premiums for both. Okay. Part A, there is a late enrollment penalty. Well, there's late enrollment penalty for all of them, all different parts, but they do charge you a late enrollment penalty if you don't apply for it and enroll when you first became eligible for it. Okay? And you may end up paying a higher premium for twice the number of years you could have had Part A and didn't sign up. However, we do advise members that if you're told that you have to pay a premium for Part A, you could apply for just the Part B only. Okay, and waive the A. And as long as you're going to our Kaiser Senior Advantage plan, we can get you onto the Medicare Part B only plan with our Kaiser plan. Okay, if you're going elsewhere, all the individual plans and carriers, they do require both A and B. So you want to keep that in mind and just reach out to us and let us know if you encounter that. All right, so Medicare Part B, it provides the medical insurance part. Okay, so this was doctor services, outpatient care, preventive care services, diagnostic tests, all those types of things. Okay, including supplies. That Part A does not cover, but there is a premium for the Part B. Everybody pays a premium for the Part B. For Medicare eligible individuals, the monthly premium in 2022 was $170.10. Now in 2023, it's gone down to $164.90. Okay, and that's the lowest standard monthly premium for Part B. So some members may pay more than that. It all depends upon what you're processing on your IRS tax returns. Okay, because what they do, Social Security does, they do a 2-year look back. So right now we're in 2023. So they would look back at your 2021 tax return to see what you reported. And then they look at that, and then that's how they determine what they're going to charge you this year for your Part B premium. Okay. All right. Now, so to enroll, you got to make sure you give Social Security a call, or you can go online to the Medicare website and start the process. Okay. Even if you're already collecting Social Security, it's always good just to give a call, because although they say it's an automatic enrollment, you still want to give them a call just to check in with them, make sure that they got everything current that they need to get you your Medicare processed. Okay. So one thing that you do want to remember is there is a period in which it's too early to sign up for. I believe that the next slide will probably cover that. That's the next slide. Yes, here we go. Okay, so there's a 7-month enrollment period. Okay, it's 3 months before your 65th birthday month. Okay, the birth month, and then 3 months after your 65th birth month. Okay, Medicare is always effective the first day of the month. Okay, so for example, let's say your birthday is let's say it's April 15th. Okay, April 15th. Okay, so if your birthday falls inside the month, okay, then that makes your effective date for your Medicare the first of that month. Okay, So basically from the 2nd to the end of the month, your birthday falls on any of those dates, your Medicare becomes effective the 1st of that month. Okay. Now, if you're born on the 1st of the month, like April 1st, then Medicare becomes effective the 1st of the previous month. It would become March 1st. Okay. So you always want to be aware of that, because that does help determine where your enrollment period is. So for example, someone whose birthday is April 15th, that's my birth month. So I would look at 3 months before, so March, February, January. So as of January, which is 3 months before my birth month, I'd be able to go ahead and reach out to start the process to enroll in my Medicare. Okay. Now, let's say, for example, I got busy doing vacation stuff or just lost track of time and so forth. At 3 months after my birth month, which is, okay, so birth month is April, so May, June, July, I have till sometime in July to still do my enrollment without getting penalized. Okay, but I don't see why I would wait till July when I could have applied earlier and start saving that money. Remember going back to that chart where I was paying, for example, I was paying the 447 out of my monthly benefit, when if I got my Medicare and got on senior badge, I would be paying 0. So why would I wait past the time where I could be saving that money? Okay, so of course you want to try to start this process early, so that as soon as you can get onto Medicare and get onto that other plan, the sooner you can start saving some of that money. Okay, so yeah, I wouldn't wait till after my birthday. I'd definitely start the process before. Okay. Now, if you miss the initial enrollment period, okay, January through March of each year, they have an enrollment period. However, the coverage won't start for you until July 1st of that year. So if you missed your window to enroll and you go ahead and enroll during the January through March, okay, which is when they allow you to go ahead and enroll, they will not grant you your Medicare until July 1st. That means that's all those months, additional months, that you're going to still have that deduction come out, for the premium that you could have been saving that money. Okay. There's a lifetime 10% penalty for each 12-month period that you did not enroll in Part B. Okay, so that's 10% of the premium in addition to the premium itself that you would have to pay. Okay, for every 12-month period that you did not enroll. Okay. Now, the only exception to this is the working aged, and what we mean by that is, for example, we still have members who are turning 65, they're still working, and they're on an employer plan. So let's say, for example, you're working and you're on the employer plan. Okay, then you can go ahead and waive your enrollment into Medicare because you're still in that employer plan. Okay, and so the way you want to look at this way, Medicare is looking at see who's responsible for whatever services and bill that you have. Okay, so you may have services, the bill goes to Medicare, Medicare's going to look to see, oh, you're on an employer plan, we're not going to pay this bill, you need to have the employer plan pay. Typically the employer plan is going to pay 100%, which means Medicare's not going to have to pay anything. Okay, now the moment you come off of an employer plan, you want to make sure you reach out to say, hey, Medicare, I'm going to be coming off my employer plan, I'm going to need my Medicare, and then they can go ahead and grant it to you, and they won't charge you a penalty for enrolling in after you've already been 65. Okay, so you get to waive that penalty. You don't have to worry about paying that. In the same way as if you're on your dependence plan, let's say you're on your dependence plan through their employer. Okay, unless their employer tells you, hey, you're going to turn 65, you can't stay on this plan, then you typically you should be able to still remain on that plan. And you can let Medicare know, reach out to you, let them know, hey, I'm still on I'm turning 65, but I'm on my spouse's plan or dependence plan, whatever, on their employer's plan. So I'm not going to get my Medicare just yet because I'm still covered under that plan. And that's fine. Okay, that's another way you can waive it. As long as you're on an employer plan, then they can go ahead and waive the penalty. Okay. Um, so another thing is you always want to compare, because you could always check in to see whether or not is their premium going to be changed a little bit because I'm now 65. That plan, that carrier plan, should be able to let you know if there's any kind of changes to that because of your age of 65 eligibility. Okay. Um, the other thing is you can always come off that plan and simply jump onto our Kaiser plan. And as long as you have, 10 or more years of service, is pretty much, as you see, is pretty much taken care of. So a lot of choices there. You can figure out which one you want to go to a plan. Okay. Next slide. Okay. So, and getting back to this, you could delay your Part B enrollment and use only the employer plan. Okay, I kind of mentioned that just a moment ago. So you enroll in both A and B and have both Medicare and the employer plan. There's likely no benefit because this is duplicate coverage. Um, and because employer plan is primary and usually provides better benefits, it's, you're basically giving Medicare money and they're not ever going to pay for any services because they're going to defer the bill back to your primary plan with that employer. Okay, so why give away money? Okay, so the other choice would be to reject the employer plan, come off the employer plan, enroll in Medicare, and then go ahead and come over to our plan or find another plan somewhere. Okay. So here's what I mean by they do a 2-year look back. Okay, so if your yearly income in 2021, okay, basically was, for example, in column 1, file individual tax return. If your income was $97,000 or less, then you slide to the right. You see, you pay each month of 2023 $164.90. Okay, if you file joint and it's $194,000 or less, you still pay $164.90. If you filed individual and it was $97,000 up to $123,000, then your Part B premium is going to be $230.80. Same thing with the following joint: $194,000 up to $246,000, $283. I mean, it's $230.80. Okay, so you see how the higher the income that you reported on your IRS 2 years ago, that's where they determine where you're going to pay for your Medicare Part B. Okay, it's a 2-year look back. So yeah, we can go ahead and change the slide now. So the good thing is this: at Sarah, we have what we call the Medicare Part B reimbursement plan, or MBRP. And what that is, every December, once Medicare releases what they're going to charge for the Part B, then we go ahead and update accordingly in our payroll system to give that reimbursement to our members who are enrolled in this plan. So basically, in 2022, okay, we were reimbursing $170.10 because that was the base amount. In 2023, it was pending. I have to update this. It's now $164.90. Okay, so they lowered it down the base amount to $164.90. Okay, so you apply for this by simply completing the Medicare Part B reimbursement form. Okay, and you attach a copy of your Medicare card that shows you have Part B, and you send that into a Sarah. Now, on your monthly benefit, if you look at your statement on the left side top box, that's where you see base amount, and below that you see your COLA, your cost of living adjustment. You would see a new line that says Medicare Part B reimbursement plan, and then you would see that credit. This year it's $164.10, $164.90. Okay, so basically you'd be paying, Social Security would deduct the Medicare of the $164.90 out of your Social Security check, but here are your monthly benefit from Sarah. We're putting in that credit of that $164.90. So basically it's a wash. Okay. Same thing if you're not collecting Social Security check and you're paying Medicare, quarterly, so basically 3 months worth. So you're sending in them 3 months worth of the premium for the Part B, but in your Sarah check, you're getting the $164.90 every month. Okay, so it's still a wash. Now, if for whatever reason your income is higher and they're telling you that, hey, you have to pay this 230, then remember you pay that 230 and Acera will still reimburse you a place of the credit on your monthly benefit of that 164.90. Okay, so you're not out that full 230, you're only out the difference between the 164 and the 230. Okay, which is still a lot less than paying that, for example, that $447 portion of the Part B of the Medicare medical premium for the Kaiser, if you recall back to that other slide. So you're still saving some money there, plus your copays drops down when you go onto the Medicare plan. Okay, now this is not a vested benefit. Okay, it's not available for dependents, nor will it reimburse dependent costs. Okay, this is only for the retiree member themselves. To qualify, you have to have at least 10 years of service credit or have been granted a service-connected disability and provide proof of enrollment in Medicare Part B and remain enrolled. Okay, so you need to just complete the Medicare Part B reimbursement form, provide us a copy of the card that shows you have Part B, and we can activate this. Okay, now this is why I say you want to try to get your Medicare earlier before it's actually effective. That way you can get all this documentation and things into it so we can get you set up in the system. This is not a retroactive benefit. Okay, so if your Medicare becomes effective, let's say March 1st, and for whatever reason you got busy or you misplaced the form or you forgot about it, and now you were in May and you say, oh, I got to send this in so I can do my reimbursement. Okay, you send it in May, we're going to start it when we get it. We're not going to go retro back to March. Okay, we don't do that. Okay, this is not an enrollment is not automatic, so you must complete the form application. Okay, it's a simple form, name and address, just sign it. Okay, that's pretty much it. And then attach a copy of your Medicare card that shows you got the Medicare Part B. Send it into Acera. It's that simple. Okay. All right. And you don't have to be enrolled in an Acera medical plan to get this. Okay, you might be enrolled in a plan through another agency, through another employer, through your dependent on your dependent's plan with their employer, whatever the case is. That's fine. This is not tied to being enrolled in an Acera Medicare plan. Okay, this is simply a years of service benefit that's granted to anybody who has 10 plus years or service connected disability and are paying and are enrolled in Medicare Part B and paying that premium to Social Security. And we would go ahead and once you provide us the two documents we're requesting, we activate an adjustment granting you that credit. Okay. All right. Next slide. Now, Part D. Part D is in David. This is the prescription portion, okay, of Medicare. All right. They too do IRS look back. Okay. So for them, if you take a look, in 2021, if you filed an individual tax return of $97,000 or less, okay, or filed joint for 194,000 or less, if you scroll look to the right, you see you're just paying your plan premium. Okay. Most plans, Medicare plans, have Part D already built into it. For example, our Kaiser Senior Advantage plan that we have with Kaiser already has Part D built into it. And the prescription coverage through the plan far exceeds what Part D Medicare prescription plan would even offer. Okay, so it's already built into it, so you don't have to worry about it having to pay anything. If you file individual tax return 97,000 up to 123,000 or joint up to $246,000, okay, then you may end up having to pay a $12.20 per plan premium. Okay, so again, they're basically what they're saying is you've made a higher income, and so this isn't part of your premium to have the Part D. Okay, this is an adjustment, and the bill will come to you, and it would state income-related monthly adjustment. Okay, so it's an IRMA is what it is. It's an adjustment, and it's kind of like a fee that they charge. It's not the actual premium that you have Part D. It's basically it's like a penalty is basically what it is. And when I look at it, that's what I think it is. Um, because you made over a higher threshold of income. And so they charge this additional premium. Okay. So you must pay that premium if they do send you one of these notifications. Because if you do not pay that additional premium that they're asking, then what happens is they will disenroll you from the part from that Medicare, which causes conflict with the plan, which then the plan disenrolls you, which means boom, all of a sudden now you have no coverage. Okay, so we got to make sure you keep that any payments to Medicare um, flowing, you keep the payments current, and so forth, because you don't want to have any disruption with medical coverage. Okay, especially now during this time when there's so much illnesses and so forth going on coming up. Okay, next slide. All right, so there's two types of Medicare plans, and this is always gets people confused, but it's actually real simple. All right, so I'll break it out for you right now. Okay, so basically you have Medicare Advantage plans. Okay, a Medicare Advantage plan is a plan, it's a Medicare plan where you are basically tell Medicare that, hey, this is my plan and this is the doctor I'm going to go to. Okay, so Medicare assigns your Medicare benefits to that carrier. Okay, so you have a specific carrier. It's kind of like an HMO. Okay, you have a primary doctor that you select. You got to go to that primary doctor to get a referral to go see a specialist. Okay, most Medicare Advantage plans, they do, like I said, they do have the Part D prescription plan built into it as part of the plan. Okay, chances are you're going to have some co-pays, and you must reside within the service area of that plan. Okay, so that's always key too. When enrolling into a plan, you got to make sure you're staying within the service area of that plan. Okay, now Medigap plans, okay, Medigap plans or supplemental plans. Those are plans where Medicare is not assigned to the carrier medical group. Okay, and although you have a doctor or favorite doctor that you may like to go to, you have no primary MD under these plans. You have a doctor you like to go to, you probably do go to, but they're not, you're under this plan, they're not listed as primary because it doesn't have a system to set up like that. Okay. With Medigap supplemental plans, you can go see any doctor that takes Medicare nationwide because Medicare is what's primary. Okay. So it says Medicare is nationwide. On a Medigap supplemental plan, your coverage is nationwide. Okay, you may be here in California, but you want to see that doctor that's over in another state. As long as they take Medicare, you can go over there and see that doctor. No referral needed to see a specialist. You can see any specialist nationwide that accepts Medicare. Okay. So, for example, if your doctor tells you, oh, you're going to have this procedure done to your eyes or your heart or your knee or whatever the case is, okay, and you do your search, you see that the specialist that handles that stuff the best is in another state. Well, you can contact that specialist, see if they accept Medicare. If they do, then you can go and make an appointment and go out there and see that specialist that you want to see. Okay, the coverage is nationwide. These are medical only. Okay, they do not have a prescription component to it. Okay, it's only the medical stuff. So you will need to enroll into a prescription Part D plan. Okay, and if you're going through via benefits and you sign up for a Medigap supplemental plan, the representative there knows this and will assist you to sign up for a prescription Part D plan so that you can have your prescriptions covered as well. Okay, depending upon which Medigap supplemental plan, there are some co-pays, and there may be some deductibles depending upon the plan you select, because there's different levels of Medigap supplemental plans. Okay. Again, United States is the service area nationwide. It's Medicare. Okay. So that's one of the plans that a lot of the members go into these types of plans, especially if they travel a lot, or if they go and they stay with family members or, different areas. And they don't have to worry about, well, I'm not too far from my doctor from where I'm at or whatever the case is. Some go with the weather. If it's warmer in another state a few months of the year, they go stay over there with some family, or they have a vacation place, whatever the case is. They go visit the grandkids, whatever the case is. in a few months, and then they come on back. So with this plan, you can go any doctor that you need to nationwide. Okay. Okay, so Sarah sponsored plans. Okay, so for the non-Medicare eligibles, okay, we have Kaiser HMO, we have United Healthcare Signature Value HMO, we have United Healthcare Signature Value Advantage HMO. Okay, for the Medicare, once you become Medicare eligible, you have Kaiser Permanente Senior Advantage, and then if you don't want to go into that, you can reach out to VIA Benefits, and they can assist to find you a plan that's in your area. Okay. And United Healthcare, if you list on that plan, you're going to go to VIA Benefits, let them know that that's what you currently have, and you want to stay within that family, and they can go ahead and find you what United Healthcare Medicare options are in your area. Okay. Now, the Kaiser Permanente Senior Advantage. Okay, our Senior Advantage is only here in California. Yes, there are Kaisers in other states. You know, they're in Hawaii, Washington, Colorado, Georgia, you know, there are various states. There's all kinds of Kaisers in other states, yes. But our Kaiser is only here in California. Okay, so you have to reside in the service area of our Kaiser here in California. Okay, and for 2023, by yourself on this Senior Advantage plan is $316.81. Yourself plus your dependent, both of you having Medicare, it's basically the 316 twice, so it's 633.62. If you have a family, 2 of you are on Medicare, and of course the dependent, the younger dependent on Medicare, the family coverage is $1388.74. Okay, so the benefit is on the Senior Advantage plan, your copays right now, the non-Medicare, the HMO, the copays are $15. When you go on to Senior Advantage, your copays drops down to $10. Okay, and that can be that can actually save quite a bit of money in itself, because there are some members who are on quite a few medications, and at $10 a pop, it, you know, it does start to add up after a while if you're on quite a few medications. Okay, so for 2023, the KIPS plan, it does have the Senior and Fit gym membership added into it. So if you're enrolled in our Kaiser Permanente Senior Advantage plan, you can reach out to Silver and Fit and get yourself set up with a gym to, you know, exercise, work out, whatever it is you want to do with these gyms. Some members just go and they deal with, you know, whether it's the yoga, the swimming class, you know, just go use a sauna, whatever it is that they want to do with the gyms, they can go ahead and do. Okay? And that's at no cost. A server does require that retirees and dependents be enrolled in Medicare Parts A and B upon eligibility, enroll into the SERA-sponsored Medicare plan in order to have the medical coverage through a SERA. Okay, so you got to get that enrollment in so you can continue on our coverage. Okay, now Part B only plan is available for the Senior Advantage plan. So, and this is typically like safety members, if they've always been a safety member, like a deputy or district attorney or something like that, inside with the county, so they've never paid into the system, then and you go to apply and they tell you, oh, well, you're gonna have to pay for Part A. You can waive the Part A, just enroll in Part B, and still get onto this plan, the Senior Advantage plan. It's an agreement that we have with Kaiser to be able to offer this Part B only plan. Okay. Now you can always check with them to see whether or not you may qualify for the A based on a spouse's eligibility. Okay, so if your spouse has paid in all the quarters and they're over a certain age, you know, you may qualify for Part A that way. You know, if you're told that you have to pay for it yourself. Okay, so that's another way you can check with Social Security to see if that's an option for you too. Okay. Stop. Okay, again, the Sewer Fit is something that everyone's been asking for a long time. We finally were able to get it on board. It's part of our benefit now. If you're enrolled in Senior Advantage, you can work out the cardio and strength training equipment, all kinds of stuff offers, whatever stuff that's offered at the gyms, pretty much utilize. Okay, you can also have a home fitness kit sent to you if you're signed up. If you don't want to go to the gym and work out, you let them know. They could Silverfit could send you a home kit, and you'll be able to work out there in the privacy of your own home. Okay. So, yeah, there's lots of digital workout videos that on their website. There's a mobile app, a lot of stuff that to help you maintain health and stay in shape. Okay, we always want to try and stay healthy. Right. Again, you can call that number there. You can go online, silverfit.com, and register. There's a lot of ways you can go ahead and get more information and check in with them regarding the Silver Fit. Okay. Again, the Silver Fit, it's not necessarily not through Kaiser. It's a benefit that it's a third party. Okay, and they do Kaiser. It's part of it's what they're working with Kaiser. So as long as you're enrolled in our Senior Advantage plan, then you're eligible to sign up for a Silver Fit. Okay, at no cost. And so it's not a trial anymore. We've actually added it to the benefit for this year, 2023. Okay. Now, via benefits. Okay, for those who don't want to go to our Kaiser options, you contact via benefits. It's nationwide, and they can go ahead and these are not an Acera group plan. So these are individual plans. So these are not going to show up on your monthly benefit statement from Acera. Okay, and since these are individual plans and they're not going to be on our statement, there's no way for us to pool your premium to pay these insurance carriers. Okay, so you would be responsible for paying the monthly premium for the plan that you sign up with, okay, directly. So you would pay that premium to them, okay. Let's say you sign up for an example, Blue Cross. Okay, you sign up for Anthem Blue Cross, and so you would pay Anthem Blue Cross their monthly premium for your plan. They turn around and report to Via Benefits, hey, we received the premium payment this month in this amount from la la la. So, okay, so Via Benefits then turns around and looks and sees that Acera has created a health reimbursement account for you. Okay, so then they pull money out of that health reimbursement account and they reimburse you your premium, which you paid. Okay, once again, when you sign up to your plan with Via Benefits, okay, as long as you are eligible for a monthly medical allowance, okay, 10 plus years of service or service connected disability, then what happens is you get a health reimbursement account. And Via Benefits will be able to reimburse you for all your out-of-pocket medical items out of that account for the year. Okay, so throughout the whole year, they'll be able to reimburse you whatever you paid out of pocket, whether it's your co-pays for an office visit, whether it's you had to buy a knee brace or some kind of medical device that the doctor told you had to have, prescriptions, you bought prescriptions, whatever it is out of pocket that you paid, you can complete a claim form and send it into Via Benefits, and that way they can reimburse you back your money. Okay, so as long as you still have a balance, they'll be able to go ahead and continue reimbursing you for the year. I'll be coming to the amounts in just a moment. Okay, this is only for the retired member. Okay, the reimbursements, dependents do not qualify for any reimbursements. Okay, this is only for the retired members themselves. Okay, and no, it's not no dental and no vision because you already have dental and vision through Acera. Okay, retirees have dental vision through Acera, and that covers that. So this is just for medical. Okay. Again, only the retiree members are able to submit claims to the HRA for out-of-pocket expenses for dependents are not reimbursed. Okay. All right, so the way to do it is they don't have any standing offices or anything like that. So basically, enrollment is done online. You can give them a call and set up an appointment. It's basically an interview on the phone. They're going to ask you all the necessary questions that would typically be on an application. I highly recommend that when you do make the call, that you have all your prescriptions with you. Okay. The carriers over there with on the individual side, they do require both Medicare Parts A and B. Okay, They require both A and B. So individual carriers, they're real strict on that. They really want to get paid, because if you ever think about it, you start to get turn 65, you start getting truckloads of junk mail, right? Sign up with us. Oh, we'll give you a duffel bag. Oh, sign up with us. You know, this and this. You know, and prices are just incredible, you know, to believe. And it's a matter of these carriers, they want you to sign up with them, with your Medicare. Why? Because Medicare pays a stipend, a monthly stipend, whether you go to the doctor or not. So if you're one of those that, oh, I'm not feeling well, but I'm not going to go to the doctor. I don't want to go to the doctor. I'll just take a few aspirins and that's it. Okay, they really like that, because they're getting paid a monthly stipend by Medicare to be able to provide you services when you need it, but yet you're not going. That's just free money for them. There's no services that they have to pay for because you're not going to the doctor. So that's one of the reasons why a lot of these insurance companies and stuff be sending you all kinds of junk, because they all want you to try to sign up with them so they can get that stipend. Okay, so you know, again, you want to make sure that if you're not feeling well, you have any kind of ailments or something's going on, always reach out and check in with your doctor. You never know. It could be a little something that could be a signal of something that's further down the road that you want to catch these early if something is actually going on. Okay. So again, most of these, most Medicare Advantage plans have Part D, which is the prescription built in. Okay. Again, Medigap supplemental plans are medical, so you will need to sign up for a Part D prescription plan, and the representatives at VF Benefits will do that for you. So a licensed benefit advisor will go over the plans in your area, and you'll be able to select which one you'd like. Okay. Plans are nationwide, so it doesn't matter where you reside. Okay. Reimbursement available for retirees out-of-pocket medical expenses. Okay, so medical, prescription drug, plan, premiums, prescription copays, deductibles, things like that. Okay. You can have auto pay and direct deposit available. So instead of, you can sign up for auto pay where your carrier is automatically doing the deduction out of your account to pay for your premium. Okay. And then you can also set up for direct deposit with VF Benefits, so that when they do process your reimbursement to pay you back your money, they can simply redeposit that right back into your account. Okay. It's either that or they mail you a hard check. And with the post office being delayed a lot of times, and with the bad weather that's been going on, some areas have snowed in and so forth, and these bad rains, you know, you want to, it's easier to get direct deposit. That way, boom, your money's there. You're not dependent upon, well, you know, I don't know how the mailman's going to get up this roadway if it's all snowed in and so forth, or whatever the case is going on. Okay, direct deposit, you can set that that's set up. Okay, reimbursement for the current year must be claimed by March 31st the following year. So, for example, we are in 2023. Okay, and so you're enrolling the plan with VF Benefits. You're getting your reimbursements done, items out of pocket. Come December 31st at midnight, whatever balance you have of monies left over to get reimbursed out of gets wiped out to zero. Okay, so your balance, it's unused, is wiped out to zero. And then at midnight, January 1st, boom, you get a brand new dollar amount for the new year of 2024. Okay. However, let's say now you're in February of 2024. Okay. And finally, that doctor's office or whatever that is, they finally complete their billing stuff. And you know, this for services that you did receive and pay for in 2023. Okay. So you have until March 31st of 2024 to supply or submit that claim for something that you paid out of pocket in 2023. Okay. They'll take a look and see, okay, at December 31st, you still had this much money left over. Okay, so they did have the money at that time. We're going to go ahead and reimburse them for that 2023 item. Okay, so although the money's refreshes again on January 1st, you still have to March 31st for reimbursement out of any balances that you had available, you know, for 2023, for 2023's service that you paid out of pocket for. Okay, so you still have some time. There's a grace period there. Okay, with VF Benefits, they do have on health online health reimbursement account tracking and so forth. Their app is pretty nice. You can submit claims through the app. Okay, yeah, attach the PDF, send it to the app, submit it in. You can go in there and check the status of a reimbursement claim, okay, to see whether is it pending, is it processed, was it mailed, whatever the case is. You can check the status of all those things. Okay, so Via Benefits, they do pretty good job at keeping up on those items, and they do report to us, Sarah. Okay, I know some members when we first started with the HRA accounts, they would be upset that, oh well, I really didn't utilize all the funds because I was healthy this year, and I'm kind of upset that I didn't use all the money, and now Via Benefits has the money that I didn't use. No, they do not. They do not have the money that you didn't get to use out of your account. The money is always with the SARA. Okay. The only time Via Benefits gets to touch the money is when you submit a claim and they have to reimburse you. So if you submit a claim and it's $300, Via Benefits will then go ahead and process what they need to do with the SARA to get $300, and then they reimburse. They give that $300 to you. But Via Benefits never has the money, and they're only able to access the money if they're processing a claim for a retired member. Okay, so that kind of, yeah, a lot of members getting upset thinking that Via Benefits was keeping the money that was left over, and they not. The money is always with the SARA, and it stays within the fund. And I see we have Bree, do we have two questions? I think I see a little red dot.
Yeah, we have two questions. The first one is, hello and thank you. And where does the money for the reimbursement come from?
Okay, so the money for the reimbursement comes from a health reimbursement account that a SARA creates every year for the retired members that go over to a plan through Via Benefits. Okay, so we maintain it here at a SARA. We take care of it. Via Benefits just has access to pull monies out of that to provide to you as a reimbursement.
And the second question is, what happens if we have Kaiser Senior Advantage and I'm traveling and I have a health emergency?
Okay, so just I'll repeat the question. So what happens if you have Kaiser Senior Advantage and you're traveling and you have an emergency? Okay, all medical plans have emergency services in the event of an emergency that something happens while you're away. Okay, same thing with Kaiser Senior Advantage that we have. So Kaiser, if you're traveling and heaven forbid something happens to you, you get sick, or you get injured, whatever the case is, you'd want to seek emergency services, to seek medical attention, get yourself taken care of. Okay, of course, while you're in there and admitted, provided that it's just not so serious where you can't speak or you're conscious, you can let them know that, hey, I do have Kaiser. You can show them their medical Kaiser card. It has a number there. That hospital, wherever you are, somewhere else, will be able to reach out and coordinate with Kaiser, letting them know, hey, we have your member here at an emergency. That way they can try to do it and coordinate with Kaiser regarding emergency services. Okay, so every plan has emergency services in the event that you're out of the service area or away from home. Whether it's visiting on vacation or just traveling, whatever the case is, they all have emergency services. Okay.
And we have one more question as well. Does reimbursement cover premiums?
Yes. The health reimbursement account, you're able to get reimbursed for your premiums for your medical plan, for your out-of-pockets for your office visits, for your out-of-pocket for prescriptions, deductibles, anything that's medically necessary, okay, that you had to pay out-of-pocket for, you can go ahead and submit a claim to Via Benefits and get reimbursed through the health reimbursement account, provided you still have enough balance in there. And I believe I got a slide coming up pretty soon that's going to show the amounts that gets placed in there.
Hey, Ish, we got one more question too. This one is, can you switch plans during open enrollment after you first select a plan? For example, if I switch to Kaiser this year and then want to go back to UHC during open enrollment through VIA.
Okay, and the question to that, can they switch during open enrollment period back and forth with that? And yes, you may. That is exactly what open enrollment is for. Okay, So for example, let's say you're on our Kaiser Senior Advantage plan now. Open enrollment comes and you sign up for a plan through via benefits, okay? And you're going through the plan, it's going through the year, you're having to submit claim forms and so forth, and you don't want to necessarily stay on that plan anymore. Okay, so the following year, open enrollment comes around, you can simply apply back during open enrollment to an ACERA plan, and we can go ahead, as long as you're residing in the service area still for the Kaiser Senior Advantage plan, we can get you back onto the Senior Advantage plan. Now, the thing you want to keep in mind is open enrollments are a little bit different. Okay, so for example, at least the time frame, should I say, ACERA, our open enrollment for our group plans is the entire month of November. Okay, typically we have at the end of October we have our health fair. Lately it's been virtual. We have virtual health fair right at the end of October with presentations and things like that. So, and we send out our open enrollment packet to all of our payees right around, I think it was like around the first week of October it goes out. Okay, so it has whatever plans we have, the premiums and things like that in the booklet that's in that big packet that comes to you. You have all of November from the 1st to the 30th to submit an open enrollment change to enroll back onto our plan. Okay, that plan will become effective February 1st because that's the beginning of our plan year, service plan year. Now, open enrollment through via benefits, because that's on the individual side, it matches open enrollment for that Medicare has. So basically, open enrollment on that side is October 15th through December 7th. So you have all that time to enroll into a plan over there with via benefits. Okay, and that plan would, if you enroll into a plan over there, because those are individual plans, those become effective January 1st, because the plan year on the individual side is calendar year. So January 1st through December 31st. Okay, ACERA's group plan, our contract with our carriers is February 1st through January 31st. Okay, so if you're on our Senior Advantage plan and you want to jump over to via benefits during open enrollment, the plan you sign up for with them over there would start January 1st. So we would drop you from our plan so that you could be on that plan as of January 1st. Okay, so you'd be on there with them on January 1st. If you were over there with via benefits and you're trying to come back to ACERA, okay, our plan year starts February 1st. So that means their plan year over there on the individual plan that you're on right now would be still needed by you for the month of January, because our plan year starts February 1st. So you would still have 1 month of having that plan that you're on until our plan kicks in February 1st, because our plan year starts February 1st, not January 1st at the individual plan. But yes, you can go back and forth. Okay. Now, there is something that everybody should be aware of regarding Medicare Advantage plans and Medigap or supplement plans. On your initial enrollment, now you first become Medicare eligible. Okay, the Medicare is watching to see what you roll into. So if you all of a sudden sign up for a Medicare Advantage plan, okay, that's fine and dandy. Now, if later on you decide, okay, I'm going to switch over to a supplement plan, a Medigap plan, okay, then they're going to be watching to see, okay, because they may put you through, you're going to get into a plan, but they may put you into underwriting, go through underwriting, and then go ahead and authorize you to be on the plan. So that the thought is this, is there a reason why this person is switching from an Advantage plan to a supplemental plan, or from a supplement plan to an Advantage plan? They look for things like that. And sometimes what they may do is they may bump up the premium just a little bit more, just to allow you to have that changeover. Remember, they can't deny you. Okay, they can't deny you coverage. They back when Obama did that signature thing that he signed, carrier medical plans, they can't just say no to you regarding that. So what they do now, they put you through underwriting to make a determination. Okay, is there a specific reason or what's going on that they all of a sudden they want to change the specific types of plan? It's okay to move from a Medicare Advantage plan to Medicare Advantage plan, or supplemental plan to supplemental plan. But when you're hopping back and forth from the completely different types of plan, then they're, they may take a look at that and see whether or not they may want to charge you a slightly higher premium for that. But yes, you are able to make changes during open enrollment, or even during a qualifying event. Because let's say you're on a Medicare Advantage plan now, and you went somewhere and you fell in love with this new other house somewhere, and you bought that house, and now you relocated, but that house happens to be outside the service area of your Medicare Advantage plan. Well, you've relocated out of the service area, so that's a qualifying event that allows you to change plans, because you have to change plans because that plan is not going to cover you at the new place, right? So there are certain qualifying events that allows you to also make changes. Okay, I hope I clarified that for everybody.
And we have another question as well. If you switch from Kaiser Advantage to regular via Medicare during open enrollment, just because you move out of state, do you still have to go through underwriting?
If you would, okay, so if you on Senior Advantage, move out of state, you go to another Medicare Advantage plan outside of, out in another state. Nah, there are certain ways. Like if you go to an Advantage plan to another Advantage plan, they don't sweat that. It's when you're switching types. For example, Medicare Advantage plan to a supplemental plan, they may take a look at that. So they may, and it's up to the individual carrier. So they may put you through underwriting, they may not. Some carriers have different rules. Kind of like some of them, because there's not too many other carriers doing business in certain parts of the country. They pretty much run the show, so they pretty much can charge what they want because they're the only player in that area. So of course people are going to sign up for them. Whereas if there's other carriers, multiple carriers also providing coverage in that area, then they got to be a little more competitive, and they try to lower their premiums because they want you to come with them instead of going to the other carrier. So there's more competition. So they try to wheel you in by giving you a good deal on premiums. Okay. All right, here we go. Now, with VIA benefits, one of the items that they have that's really good, I find it very neat. It's called a prescription profiler. Okay, and I always encourage members to check in with them. The vast majority of members, and I'm always watching because I have to report this information to the board, our board of retirement. So a vast majority of members, once they get into a plan, they're pretty much good to go. They're happy with the plan. It's very rare that they change. The vast majority of these members who have gone in to a supplement or Medigap plan, and of course, they get a prescription plan. Okay, they're good with the medical plan. It's the prescription plan that I always tell them, okay, come open enrollment, come October, reach out to VIA Benefits and have them check in on your prescriptions. Okay, so because these pharmaceutical companies, they're always creating brand new medications, or they're changing medications to a different tier. Okay, so as they develop brand new stuff, some of this other stuff that people are already on may reduce down in price, or whatever the case is. So you always want to check in with them about your prescription plan, and they will run it through their prescription profiler. What that does is it's a database that they have that takes your medications and searches it through the various prescription plans. Okay, and then they're able to see, okay, hey, your prescriptions are all covered by this plan, and it's at a lower, copay. Your prescription is covered through this plan. Most of them are lower. Well, this one's a little bit higher, and this premium for that plan is this. So you can kind of get a good comparison. Okay. Chances are the prescription plan that you're currently on may still be the best one, but there might be another one where it covers your prescriptions at a lower cost and at a lower premium, where it could save you some money. And then you can say, okay, well, hey, go ahead and switch me over to that one. And they'll go ahead and assist you to change over. So the prescription profiler is always good to check in on every October when open enrollment comes around over there. Okay, because you never know, you could be saving some money. But that's the main change of our members who have gone to VIA Benefits is their prescription coverage. They're always checking to see whether or not have anything changed, where they can pay lower for their copays, lower for the premiums. So that's the one big thing I always encourage on for those members in October. Okay. Right. Okay. Again, open enrollment, your annual opportunity to assess your benefit needs and make the changes. Okay. Okay. You can change your medical, dental, and vision plans. You can add or remove dependents, cancel medical, dental, vision coverage. Of course, retirees with 10 or more years of service, there is no canceling dental and vision because Sarah we place you on the dental and vision and we subsidize it at 100%. Okay, depending upon which plan you're on. So you can't just enroll from the dental. So even if you got dental from another agency or your dependent or whatever the case is, you're still going to have your dental and your vision base plan from Sarah. Okay, there's no stopping it. It's a contract agreement that we have with the dental and the vision plans that to provide us the low premium and the services that they provide, that we would go ahead and enroll all of our retired members with 10 or more years of service. Okay, so but if you have less than 10 years of service, then yeah, it's a voluntary deduction. You can choose to not have it anymore if you choose not to. Okay, but if you have a service-connected disability, then it's you're covered. You're covered on it regardless. Okay, so Sarah's open enrollment period again, it occurs the entire month of November. Okay, and your elections become effective February 1st the following year. VIA benefits, their stuff opens October 15th, runs to December 7th, with their choices that you select becoming effective January 1st. Okay. And then your monthly benefit allowance must be sufficient to cover the cost of the plan you select, at least the ones that are on our Sarah. Okay. So for example, our Kaiser HMO is 909. Okay. If you, all of a sudden you decide to enroll in it, but you're only getting, $900 a month. Well, your check's not big enough to cover the 909, so you can't enroll into that plan. So your benefit has to be large enough to cover the cost of the premium for that. So always keep that in mind, especially if you're attempting to add a dependent onto the plan with you. If your monthly benefit isn't enough to cover the two-party premium, then you can't add them on. Okay.
And we have another question here as well.
Yes.
Says, I've been told by two different VIA counselors that my dependent that I cover on my medical can be covered by a different provider than I choose for Medicare. For example, I can choose Kaiser Medicare and my dependent can be on UHC through VIA. But as Sarah says, my dependent has to be on the same provider. What's the answer?
Okay. Well, it's kind of true on both sides, but they're not being specific enough with it. They're too bland. Okay. So for example, let's say you're both on on Sarah's plan. Okay. The dependent, the retiree is the anchor, the primary anchor. So any dependent has to be where the retiree member is. So if the retiree member is is on United Healthcare plan with your dependent, and they become Medicare eligible, and that retiree member decides to jump over to our Kaiser Senior Advantage plan with the Sarah, okay, then the dependent would need to move over to the Kaiser, okay, if they want to stay on the plan with the retiree. Otherwise, if they don't want to go to Kaiser, they can go try to find a plan through VIA benefits, but they have to be. You can't have the retiree member on Kaiser and the dependent on United Healthcare. It doesn't. That's not possible. The retiree member is the primary anchor. The dependents must follow with the retiree. You can't have one on each plan. Okay. Same thing is if the dependent, if the retiree member decides not to go to Kaiser Senior Advantage and decides to go find a Medicare plan through VIA benefits, okay, well, the dependent can go ahead and move on over to with them over to VIA and still find a United Healthcare HMO plan over there if they like, but they wouldn't be able to hop over to our Kaiser plan. If the retiree went to VIA benefits, the dependent would need to go ahead and go with them. They can't just stay on the plan, just like they can't hop over to Kaiser and have one on Kaiser, one on that healthcare plan. Retiree member is the primary anchor. Oh, I hope that kind of clarifies. All right. Okay, so monthly medical allowance. Okay, so this is what the amounts that a Sarah pays towards the premiums for members that are enrolled in the plan. So for 2023, as you see, a 20+ year old member, 20+ years of service member, non-Medicare, okay, we would pay up to $616.12. Okay, and then going all the way down, under 10 years of service, we don't pay anything at all, okay, towards the medical plan. Now, on the individual side, okay, on the individual side, so if you went over to VIA benefits, 20+ year members, okay, we're with Medicare, okay, we are subsidizing or putting in, it's $471.99 per month, okay, is what's in there. Now, what the there is what that constitutes for the year. Let's pull it up real quick. Benefits. Okay, so what this constitutes is this. Okay, so looking back at the chart again. Okay, so a 20-year member, okay, that's under 65. Okay, then for the year over it with VIA benefits, if they didn't, of course, they wouldn't be residing here in the service area of our Kaiser United Healthcare Plan. Then that's $616.12. That comes up to $7,393.44 for the year. Okay, that they can apply to get reimbursements from. Okay, now someone with Medicare on the bottom one, individual Medicare plans through VIA benefits, 20 years of service or over, that $471.99, that comes to $5,663.88 for the year. Okay, so someone with Medicare who goes over to VIA benefits and they're paying their monthly premium, okay, they get reimbursed. They're out of and their out-of-pocket items, they can get reimbursed for up to $5,663.88 for the year. Okay, someone with, let's go down to 10 to 14.99 years of service at that $236 a month, that is $2,832 for the year. Okay, now a vast majority of members who have Medicare who went over to VIA benefits never use all the funds that we put in to their health reimbursement account. They don't use it all. Very few have used, end up with a zero balance when they're on that Medicare plan over there. And the reason being is the premiums for the plans over with VIA benefits are extremely lower on the individual side for the Medicare plans. Okay, so for example, like our Kaiser Senior Advantage plan, it's an employer group plan. It's a very rich plan. So yes, it's $316 a month, and of course we subsidize at $316, or we subsidize up to according to your years of service. Okay, so a Medicare plan through VIA benefits. So, for example, Medicare plans, the supplement plan, the average cost of a Medicare supplemental plan is $170. Okay, a Medicare Advantage plan with prescription drug plans, that's $48. So you can kind of see how it's a lot lower on the individual side for the medical premiums for these Medicare plans. A prescription drug plan, the average price is about $31. So you figure if you've got a Medigap supplemental plan, $170, and then $31 for the prescription plan. So you're paying, so it costs you $201. Okay, and if you're getting reimbursed, depending on where you are, let's say you're a 15 to 19.99 years of service person, you know, you're eligible for $353.99 a month, and it's only cost you $200 for the medical plan. That still leaves $153 for that month. So whatever you don't use for that month, it stays in there, and it just keeps accruing, 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 accruing until the end of the year. Okay, and then depending upon whatever services you have or claims you have that you paid out of pocket for, you would go ahead and submit the claim forms according to the benefits and get reimbursed because you have a balance. At the end of the year, like I had mentioned at the beginning, come December 31st, whatever balance you have gets wiped out to zero, but you still have until March 31st of next year to submit any claim items against the balance that you still had at the end of December for any services or out-of-pocket items that you had in 2023. So you see, there's a vast majority of members never use all the monies up that we put into the health reimbursement account. Okay, I mean, there's, for example, I got a member who calls me every so often just to check in, and they're over in Georgia, and they're paying very little for their actually they're on Kaiser over there, and they're on Kaiser Advantage, and they pay a very low premium. And same thing with their copays for their prescriptions. So they never run out of HRA monies to get reimbursed for whatever it is that they pay out of pocket. So it's all good. Any questions on these?
Yeah, we have two more questions here. The first one is, my husband is Medicare eligible and I am not yet. What would be my monthly cost if he goes over to Senior Advantage with my plan?
I'm sorry, can you put that one more time? I'm sorry. So yeah.
Yeah, it says my husband is Medicare eligible and I am not yet.
Okay.
What would be my monthly cost if he goes over to Senior Advantage with my plan?
Okay, so if it goes over to Senior Advantage with your plan. Okay. All right, so I'll take it. You're on our Kaiser plan. Let's take a look. Okay, so well, depending on what your years of service is, can you let us know how many years of service you have? How many years of service did you work for the county?
See, I'm waiting to see if they'll write anything in, but we haven't gotten anything yet. Yeah. Here we go. 20 years.
20 years. Okay, so 20-year members. Okay, so the cost for that. Okay, so your dependent, if they go on to Senior Advantage, it will cost the 316. Yeah, that 316. 316.81 is what it costs to be on Kaiser Senior Advantage. So since we don't subsidize towards dependents, it will cost you the 316 for them. And you said you have 20 years of service, so we would be subsidizing 616.12. Remember. Okay, so it would be, so one party, so basically two party, one with Senior Advantage, one without. That is 1226.55. Because basically you just take the 909.74 for the HMO Kaiser and you add 316.81. So you have the 1226.55. We would subsidize 616 for you on your behalf, and that leaves the difference for your dependent to 316 plus the so 293.62, because of the 909.74 that it costs for you to be on the HMO, we subsidize 616.12. So it costs you yourself 293.62. So 293.62 plus the 316 for the Kaiser Senior Advantage for your dependent And that's what those two added to those two months together, which is what it would cost you on the plan if your dependent came over to the same Advantage plan once they enroll. So it would drop down. That's a pretty good drop though, because a two-party HMO is right now it's 18, 19, 48. We're subsidizing 6, 16, 12 for you. So it's right now it's cost you 1203, 36 a month to have both you and your dependent on the plan with you. So the cost of 909 for him would drop down to that 316. So you'll be saving quite a couple of $100 easily, tremendously. Yeah.
All right, we have 2 more questions. And the first one is, so is all this MMA separate from the 164.90 reimbursement?
Yes, it is. This is just, the MMA is just the monthly medical allowance that goes towards the premiums, depending upon the plan you're enrolled in. The MBRP of the Medicare Part B reimbursement of that 164.90, that, remember, that is totally separate. It doesn't matter if you're enrolled in a medical plan with us or not. It's a years of service benefit, totally separate. So as long as you have at least 10 years of service or service-connected disability, and you are the retiree, okay, you fill out the MBRP form and you provide a copy of the Medicare card that shows you got Part B, and in your monthly benefit, we will add the credit line of MBRP plan and give you that 164.90 every month. And it changes every year. Like I said, last year, the base amount was 170.10, and then this year, Medicare lowered their cost down to 164, so we adjusted it down to the 164. You know, who knows? Maybe next year, if they raise it back up again, then what happens is once we find out what Medicare is going to charge for that Part B base amount, we take that. I place it into a memo and we present it to our board of retirement, and we let them know, hey, Medicare is looking to charge this amount for this new year. We would like to match that, and then the board will authorize us. And as long as they authorize us, and they have authorized us every year, then I'm able to have my my team update everybody's record to grant that new amount. Okay, so yeah, it's totally separate from this MMA.
Great, thanks, Ish. And so we have 2 more questions now. The next one is, do you know why Acera does not offer a non-Medicare Advantage group plan option?
Well, with Kaiser and United Healthcare, Acera, we don't hold the contracts. The county of Alameda actually holds the contracts, and they are gracious enough to allow us to have our retirees enrolled into the plans. Now, granted, when you start mixing, the active employees and, of course, the older population of retirees, it causes there's an impact to the premiums, okay, which means basically the premiums are going to be much higher because they're looking at utilization of claims and things like that. So what we end up doing is, if you've ever listened to some of these board meetings or looked at any of the financials, you probably may have heard about the implicit subsidy payment that Acera pays to the county. Okay, so because we have our retiree population in with their active employees grouping, carriers want to charge a much higher amount. Okay, so what ends up happening is to help balance that out, because our population as retirees is causing an impact to the active county, but they're nice enough to allow us to have these plans. What we do is we pay the county this implicit subsidy, which is we give them, I mean, it's a couple of million, boom, every year. And so what that does is it helps to offset. So basically, if the premium, let's say just with the active county employees, let's say that premium was going to be $600. The carrier is going to charge $600. Okay. Now all of a sudden we want to add these retirees also to the plan. Then the carriers may say, okay, well, wait a second, let's take a look at this. Then they look at it, say, okay, well, if you want to add this population onto the existing group, that's fine, but it's not $600. Now you have to pay, let's say, $725 per person. Okay, well, that's kind of not that's kind of not fair, right, for the active employees. So what Sarah does is we pay the county this implicit subsidy, which is okay. It should have been 600. It's this is a higher amount because of our population. So we're going to make up that gap. We're going to make that difference up so that the active county isn't impacted because our population is now mixed in. So we pay this amount of money, which helps to offset the higher costs to the active county, which they allow us to have our members enrolled. So it's kind of a win-win for for the members and for our retirees to be able to maintain a lower premium that way. So yeah, we don't have control over the contracts. It's the county's plans. We have gone out and solicited and tried to see what we can do. But some of these carriers and so forth, because of our population, it is an older group, more utilization, so forth. They want to charge higher amounts. So it's not, and because we're a small group, we're only like just over 11,000, maybe 12,000 at this point retirees, compared to the 30-something thousand plus group of the county. So the smaller the group, the less power you have to really negotiate a good contract or amounts with some of these carriers. So we haven't been able to come out where okay, boom, that's a good deal. We can go ahead and take our own contract and save some money, or it's not like that, unfortunately, in the real world here. So, but we are always keeping an eye out. We do have representatives that are in constant contact, and they got their fingers on the pulse, trying to see if there's any possibility that some of these carriers may go ahead and provide coverage for us at a good premium. But so far, what we've seen is if we did break out on our own, premiums would skyrocket. So for now, we retain our coverage with blended with the county's plans, unfortunately. Okay, I hope that kind of explains a little bit. Trust me, there's a lot behind the scenes that goes on. We try to make sure we maintain these, and I've been in all those meetings and pushed and pushed and pushed, but we continue to push, and I'll continue to push as long as I'm here.
Cool, thanks, Ish. We do have one more question. So if I choose a non-advantage individual Medicare plan through VIA, I can keep my current Acera vision and dental.
Yes, because they're all separate. Medical, dental, vision are all separate. You have your dental and your vision here with us. So if you did go to VIA, all you need to do is just go ahead and just get your medical. That's it. But keep in mind, anything that's dental or vision, you can't put in for reimbursement, because over there, that's all medical. It's a medical reimbursement account. It's not for dental or vision, because you have dental and vision coverage through Acera already. Okay.
Great, thanks, Ish. And we do have a nice comment from one of our attendees, so I'll read that out to you too. What a great explanation about the plan choices. Thank you so much. Yes, it sounds very complicated, and we appreciate your info.
Oh, well, thank you so much. Thank you so much. Okay. All right. Let's see what else we got. Oh, qualifying events. Okay. Oops. You can go back. Here we go. Qualifying events.
Here we go.
Okay. So earlier there, someone had asked a question. Can they change plans? Well, yes. Qualifying events is the way you do it. So it's a loss of coverage, relocating out of the service area of the plan that you're on. Okay. Annual open enrollment. Becoming Medicare eligible is a qualifying event in itself. Okay. Retiring after age 65 is a qualifying event. Okay, because now you're retired, so you're coming over brand new to our plan. And of course, you'll be losing the other coverage that you have because now you're retired. Marriage, if you got married, that's a qualifying event. You can add your new dependent. New domestic partnership. Okay, you got a new domestic partner. You complete the domestic partnership application form affidavit with Sarah, and you go ahead and complete the medical or dental vision form to add them on. Divorce is also a qualifying event. Someone, believe it or not, people get divorced and they lose coverage because the ex doesn't want them on isn't going to pay for them on their coverage anymore. So of course they're losing coverage. So yeah, you go ahead and qualify to get into a plan because now you've lost coverage because your dependent has removed from the coverage that you have with them. So, qualifying events. Next slide. Okay, so again, moving out of the service area, and it's amazing how when people retire, how once we activate direct deposit, they seem to fall off the grid. We don't, as long as the money's going to the account, we don't know anything about where they are, I tell you. But it's very critical that you always let us know where you are. Keep your address current with us, because there are times where certain things may occur and we have to reach you and send you something. So it's very, very important. So don't forget to look up and look into the available health plans prior to moving. It never fails. That's, you know, so that seems to be something that people don't think about. It's like, oh, I love that house, that cottage, whenever, oh, the weather here, oh, let's go, let's do it. And then they get there, then they realize, oh, I don't have medical coverage now. Yeah. So, you know, that's not a problem. Just reach out to us. Let us know that you, hey, where are you looking at going? We can try to assist you to make sure that you still have the coverage you got, or if you need to get something different. Okay. Oh, you can always reach out to us, Sarah, for assistance. It's not a problem. And just complete the address change form. You can download it from our website or give us a call. We can mail it to you, however the case is. Retirees who reside outside of California, you may not be required to pay California state taxes. So if you did relocate out of California, you know, make sure you complete the EDD state form to have us stop taking the California state taxes. You don't need to get happy letters from our state tax board over here if you're living somewhere else, right? And of course, remit a send us our completed address change form, name change form, which can be found on our website at that address right there. Okay. Next slide.
We have one question here.
Oh, sure.
So you apply whenever you move, even though it is not tied to the open enrollment period.
Right, because if you're moving out of the service area, then the plan's no good for you because then, you know, you're not in the area where they cover. So that's why we got to check to see, okay, well, what's the zip code of where you're going to, so that we can help to identify if you're still in the service area of that plan. If you're in a plan through VIA Benefits, then you want to contact VIA Benefits, and the representative there can take a look and help determine whether or not you're still in the service area and you're okay. If you happen to be out, if they see that, oh no, yeah, you're out of the service area, that the plan that you're on doesn't cover that area, then they can go ahead and assist you at that time to transition to a plan that will give you coverage wherever it is you go. Okay. Okay, again, you can also email us any questions to us, info@acera.org. That mailbox is monitored, and it's those questions and so forth will be forwarded directly to a team member for assistance. They'll reply to you. Typically, within, you know, some of them depend upon the question within minutes to 24 hours, depending upon how complex or whatever it is that you're asking. They'll reply to you. And help you get whatever answers you need. The recording of this webinar will be posted up to our website within a few business days, so you can always watch it again on demand. Okay, and this pretty much brings the end of this webinar. If there's any questions, feel free to go ahead and ask, and I will provide answers.